Good afternoon, everyone. Welcome to my informative speech. Since we just finished with May, which is Stroke Awareness Month, I decided to do my informative speech on how to recognize the signs and symptoms of someone having a stroke. Being able to know the signs and symptoms are very important because it can help reduce the overall long-term effects of the stroke. So being able to get help quickly is very imperative for someone who is suffering from a stroke or heart attack. First let's look at the risk factors. How would you know if you are at risk for a stroke before you even have one? If you have any type of high blood pressure, high cholesterol, diabetes, heart disease, any type of sickle cell disease can be a precursor to a stroke, as well as having an unhealthy diet. If you're limited to your physical activity, obesity, abuse of alcohol or other drugs may cause a stroke. And also finally, genetics and family history also play a part in that. You could be very healthy and still end up having a cardiac issue just because of who your family is and your genes. The next part I want to look at is, will you know the signs of a stroke if you see them? The main one is any type of muscle weakness on one side of the body. What happens in a stroke is you end up with a lack of oxygen to the brain, and that lack of oxygen deteriorates your brain's ability to tell your body what to do. So depending on what side of the brain the stroke is on, you may have a facial numbness or weakness. You may see a drooping on the patient's side of the face. They may not be able to move their body in the same way. They may have tingling or muscle weakness in an arm or a foot, possible vision issues, and usually it happens suddenly. Sometimes with that you also see a change in the person's ability to swallow or to speak. To them it may sound like they're making perfect words or making perfect sense. However, it may come out blurry or garbled. That is called aphasia, and dysphagia is when you can't swallow. So they may start choking on something. They may not be able to swallow their saliva. And that's a really good indicator that there's definitely something going on in terms of stroke or heart attack for a patient. Recovery is different for everybody who has a stroke. According to the American Heart Association, you can recover from a stroke, and that's why it is so important to get help right away when you notice these signs or symptoms. The length of recovery time depends on the severity of the stroke and how long your brain went without oxygen. You can also have physical therapy. You can have speech therapy that will affect any physical changes or swallowing or eating changes or speaking changes that may have happened due to the stroke. Emotional recovery is oftentimes the hardest. If you've lost the use of one side of your body, for instance, you may learn how to adapt with the other side, but you'll still have that anger or the emotional part that you'll need to recover from. I'm going to close my speech. I hope you enjoyed it. I thought it would be a very good topic because stroke is the 5th leading cause of death in the United States in the last 2 years. Anyone that you know or see anywhere can have a stroke. So being able to help anyone is always a good plus. Thank you everyone for paying attention and listening.